Dr. Sally Spencer Thomas, clinical psychologist, mental health advocate, researcher. Welcome on the Business Brief.
So glad to be here. Thanks for having me.
It's a real treat to have you. Dr. Sally, more companies are taking steps to move past traditional employee assistance programs towards mental health programs for their employees. Tell us more about what you're seeing and why it's needed now.
Yeah, I think for a long time, a lot of companies were like, we have a mental health program, we have an employee assistance program, check the box, done. And then they went and looked at it and they found that it wasn't being used. And when they dug a little deeper, they found that most of them were subpar. So I think especially after the pandemic hit, mental health issues kind of rose to the top for pretty much everyone, whether it was burnout, concern about your kids, your parents, your partner, yourself. It was top of mind for a lot of people. And so people started peeling the layers away and realized there was a lot of work to do.
So what other trends are you seeing across industries that, I guess both excite you or perhaps, you have some concern over?
Well, I think the first thing is they are now looking beyond the EAP. And even if they had a really good one, it often wasn't being used. So they realized like there's a gap here between what's needed and what we're able to provide or what's happening. So the biggest trend that I see is really for the first time in a significant way, employers are raising their hands and saying, we need training, we need help. And prior to that, they were always like, this is not our lane. This is a medical issue. We create widgets or we do this service. This is not our lane. And now they're saying, this is our lane. It's just like a CPR training or a basic sexual harassment training or a diversity, equity, inclusion training. Like this is important for our business to function well. Yeah. And so all kinds of trainings are emerging.
And this is your business. So tell us a little bit more about how you are helping companies with respect to supporting their mental health journey for their employees and their overall companies.
When we partner with companies, they usually fall into one of three buckets. Either they're in the awareness bucket, like they've never really considered this an issue before. They don't really know too much about it. They feel out in left field. And so they just need to raise some awareness of some basic mental health literacy, how to support people through tough times, just some really basic ideas and about how to access resources and what to expect. Once they've gotten awareness that maybe we have an issue here that we need to address, the next bucket is training and building skills. We have to start building skills in our managers to address these issues, in our peers. When the issues are small, peers are often the first to notice. How can they be helpful liaisons into the resources? And then the third bucket, which is really more the advanced bucket, although I'd always love for people to start here, is the strategy building. Taking a deep dive and listening to people about what's driving distress and despair, what are the barriers to help seeking, and how can people build on the opportunities and strengths of a company to build a very robust, comprehensive, and sustainable mental health program.
So employee health and safety includes mental health and psychologically safe working environments. It's about taking care of your organization's most valuable assets, human capital, your people. In other words, good mental health practices for your employees is good for them, and it's also good for the business. How do you see the business imperative of having sound mental health support programs for organizations and their workforce?
There's really two main ways that this is really an important business imperative. Probably the first one, and the reason I got into it, I'm a clinical psychologist by training, but I also lost my brother to suicide. And that put me on a trajectory to figure out what are we missing? And what we're missing is more people helping. We just delegated it to the mental health professionals and everybody washed their hands of it. So we need to prepare workplaces for mental health emergencies. They're not prepared. And often when they happen, whether it is a suicide risk or an addiction, trauma, an overdose, they're reeling, they're on their heels, reeling and reacting. And that is very disruptive to any business. So how do we prepare for mental health emergencies, just like we prepare for other types of emergencies or health issues, and have a really solid plan in place to meet people with dignity and support on their darkest days, not with fear, but with a plan. And then the other business imperative that I see increasingly over time is that workplaces really need to start differentiating themselves as a holistic workplace that cares about the entire person, not just their productivity, not just their intelligence, but their whole being, their families. They care about what they do and who they are. I think with the emerging talent coming in, they demand it. And if they don't find it, they vote with their feet. So a workplace that says, yes, your well-being is a priority to us. You're our most valuable asset. Here's how we demonstrate that. Here's how we're going to prevent burnout from happening. That's the differentiator that's going to bring in and keep the talent that's so sought after these days.
Absolutely. And, I think you really hammered something that I think is relevant, as a business and entrepreneur myself, business owner and entrepreneur myself, this holistic, as I think you termed it, approach to people, and really, as a business imperative, really looking at the best way to not only attract talent, but to keep that talent by supporting them more holistically and ensuring that, a lot more of their needs, whether it be in work or outside of work, are ultimately helped or supported or cared for by their employers. I think that's so critical, and it is important to the business, especially today more than ever, as we look at ways to find talented people and keep talented people, which we know has huge implications for the costs associated with a business in terms of attrition and turnover and the ability to service customers and products and ultimately, keep the business moving forward and profitable. So I think that not always do people see the relationship, and it certainly isn't, just all about the numbers. It's about people. It's about caring for people. But there is a business side to making the right decisions and taking care of people. So I just love that about the holistic view that you share. So this is a big issue. It's a very important. It's a priority, Dr. Sally, and I think you know that better than most. What advice might you give, though, to employees of companies about access to mental health support through their employers?
Well, there's a couple of things I would recommend to employees. Number one is you can be an advocate in your company. A lot of times the top level leadership doesn't know what they don't know. They don't know what your stresses and strains are. I remember working with one employer and we started, doing these listening sessions. And he said, Sally, I had no idea. I had no idea how stressed our parents were about their teenage kids. I had no idea how broken our entire employee assistance program was. And so you can be an advocate. And I always tell, especially emerging talent that has been fluent in mental health issues since preschool, learning about social and emotional learning. I said, you're going to have to manage up on this one. You're going to have to gently, but firmly tell people this is a priority for your workplace, and advocate for better mental health resources, advocate for training. I've seen a lot of companies start to form employee resource groups around mental health so that people can find each other and support each other. If you are someone who needs direct support yourself, there are often resources that you're not aware of. And so to go to the benefits person and say, I need some kind of mental health support. Here are my, barriers and limitations. Do you have something for me? There's been a lot of creativity that came through the pandemic of how we provide mental health support for employees. And some of it's now telemental health, where people can access support via the phone or internet. Sometimes there's apps that can be helpful for people. And not everything is going to work for everybody. So the important thing is to persist until you find something that works for you.
And here's my advice to the employers out there: call Dr. Sally. So Dr. Sally Spencer Thomas, thank you so much for joining us.
Yeah, this is great. Thank you for making this a priority for your day.